Welcome to the Movaia Running Podcast.
Hello everyone, welcome again to the Movaia Running Podcast. Today we'll focus on probably the second least popular running injury, which is Achilles Tendinopathy. And today my expert guest is again JP. Hi JP.
Hello. Nice seeing you again.
Yeah, indeed. JP, of course, is a coach, physiotherapist, running form expert, and we're very glad to have him on board today. So, JP, let's get right into it. Can you tell us, if I'm a runner and I'm suffering from Achilles tendinopathy, what would it feel like? Where would I feel it? And what is it?
Okay. Achilles tendinopathy is actually probably one of the most prevalent injuries for a master's athlete. So when we say master's athlete, that's like 35 and up. Achilles tendinopathy. What is it? Essentially, Achilles tendinopathy is irritation on the end of the Achilles tendon, typically. What's interesting about it is we used to call it more Achilles tendinitis, but we've shifted the wording to tendinopathy. The reason that is because in a lot of cases, what we found is inflammation is not present. Because when we say Achilles tendinitis, the itis means inflammation. But in a lot of these cases, really is not much inflammation. With the Achilles tendon, there are actually different types of Achilles tendinopathy. There's irritation right at the attachment between the heel or calcaneus and the tendon, and that's typically called an insertional Achilles tendinopathy. Then if it's not quite there, but it's at like a few inches or centimeters above that area, there's something called mid-substance Achilles tendinopathy. So it's important to make those classifications because how we work on those is different. Also, the time frames and prognosis is different. Then we could talk about like how does it happen, and it's affected by a lot of different things. And the most common is from overusing that area.
So we have basically two slightly different places, right? Where as a runner, you would probably feel it. One of them is very close to the heel, and the other one a little bit above it. And then you said that they are somewhat different in the outcomes and how you treat them. Are they also different in are the risk factors? And if yes, what are they?
Oh, that's an interesting question. And I'm not sure if a lot of the research does make that delineation between risk factors. But a lot of times we just lump them together, essentially. So what I like to do is when I think about risk factors, I like to separate them between, two different sides. I think we kind of talked about this in previous episodes where, I like to think about the person's body and what are the risk factors with that compared to their training or the demands of running and what things influence it from that perspective. So when it comes to, let's say, the body, there are a few things. I think I mentioned this. Typically, this happens with older runners. So that's age is a risk factor. Another thing to consider is drugs. So being careful with certain antibiotics or medications you take. A good example of this is fluoroquinolones. So those things increase the risk of having an Achilles tendinopathy.
Another reason to be careful with antibiotics. And I think also steroids was another medication that can be a bit tricky for the Achilles.
Right. Steroids can be tricky, especially for Achilles tendinopathy. But for paratendon stuff, it might actually be helpful. I keep mentioning the paratendon. That's kind of the wrapping or sheath around the tendon because it is vascular and can get inflamed. Another thing to point out is, especially with the Achilles tendon is, on that other side of things, basically a spike in training. So if you do too much too soon, right, that's an obvious one. But let's take this a little bit of a step further. Uphill run, doing a lot of hill training. Because what you'll find, especially with people dealing with, let's say, Achilles tendinopathy, that they'll have difficulty going uphill because that puts a little bit more strain on that area. Another example is speed work. So that's something to consider specifically with the Achilles because it seems to get aggravated with more speed work, which is kind of the opposite of the knee. In certain cases, especially with patellofemoral pain or just knee, if you want to just call it knee pain, What you might find with some people is that actually their pain gets aggravated with slower running and actually feels a little bit better if they pick up the pace a little bit. But that's quite the opposite with the Achilles. Actually, speed work is the thing that I'm most careful about when I'm getting someone back into training.
That's probably a good point to talk about the function of the Achilles, right? Because you mentioned speed work aggravates it, and that's probably due to the function that the Achilles tendon has. I remember hearing once it's actually the thickest and the largest tendon in the human body. So what does it actually do when you're running?
Right. So the Achilles tendon it's one of the thickest tendons, if not the thickest. When we look at the Achilles, it helps with energy storage and release. That's the same with all tendons. But when it pertains to running, it contributes to multiple things, but its primary contributor is actually through propulsion. So essentially, to help us move forward, the Achilles tendon does a lot of that. It's a lot of force, right? So I think they've looked at musculotendinous forces. There's plenty of papers looking at this. I think in some, it's been recorded it could be 6 to 9 times body weight through that area while running.
And as you go faster, I guess.
And as you go faster, it can go even higher, too.
That goes up, right? And then as you go uphill, the tendon has to do more work. That's why it gets then more aggravated.
Right. Because then we go into the idea of what irritates the area. So what's interesting about like tendons in particular is it's almost the opposite of bones. So bones are really good with like compressive forces. However, if you want to break a bone, you want to essentially lengthen it and do some form of lengthening mechanism. For tendon, it's quite the opposite. It actually doesn't do quite well with compression. It actually doesn't do well with a two combination of things occurring, which would be compression and shearing at the same time. This is why that with insertional Achilles tendinopathy, the one that attaches near the heel, this is where when it's highly irritated, stretching actually might not be advised because it actually might flare it up. Because if you think about the mechanism of you doing, let's say, a calf stretch, that distal portion of the Achilles tendon will, one, go through compression, pushing against the calcaneus, along with causing a shearing effect as it's on the calcaneus as well. So it's just something to consider.
Okay, so be careful with stretching if you're dealing with the type of Achilles pain that's closer to your heel. So you're talking about risk factors, right? And you talked about a few of them already. You talked about age, weight, speed, going uphill a lot, and previous injuries, probably like
previous injuries is another one, right?
Yeah, that's a good old standby for running injuries, right?
Yeah.
What other things are they consider about equipment, shoes, running form, anything else that would come to mind?
Oh yeah, I mean there's a few more. Another interesting one is decreased tendon stiffness. It's because we do want stiff tendons when we run. But another thing that can be worked on is ankle plantar flexion strength. So essentially that's working your calf muscles. Limited strength in that area or weakness in that area may be a risk factor for developing Achilles tendinopathy.
Okay, so we want stiff tendons, we want strong calves, and I guess later we talk about exercises, how to work on that. Is there a difference in shoes? Do certain shoes make it worse? A foot type of shoes versus bigger heel drop?
Oh yeah, these things would have an impact. So shoes, I think about it more as a risk factor would be change of shoes. Like it's for the same reason that changes the distribution of forces. So your body might not be used to running a particular way when you use one shoe versus another. But to that point, when you have a higher, let's say more of a barefoot shoe, that does put a little bit more force around the calf ankle region. So it might make that Achilles tendon work a little bit more compared to a shoe with a little bit of a higher heel drop. So that's something to consider.
Would you consider any run form modifications for someone that suffers from Achilles pain?
Where I guess we're talking about run technique. I think something that we always care for with a lot of different areas is the idea of reducing overstriding, which essentially is when the foot lands a little bit further from the body. Because if it lands further than the body, there is essentially more loading going on in that leg. And if the Achilles tendon is more, let's say, aggravated with increased loading, getting that foot to land closer to you may be helpful. Now, to that point, we could also talk about cadence, which is a very hot topic, which refers to how quickly one takes steps. What's interesting about this, I mean, there is some research that does suggest that, increasing your step rate can be helpful for things like plantar fascia. But when it comes to ankle loading, when you increase your cadence, it doesn't make a whole lot of difference. I mean, as you increase your cadence, the overall loading on the leg changes. But a lot of the decreases in loading actually happen more so from the knee and hip area, and not so much the ankle area. So, if we're trying to decrease loading on the ankle calf complex, increasing our cadence might not necessarily be beneficial in that respect.
So there's a few things we discussed already that might be worth looking into, apart from the fact that you can't change yet, like age. So once you're suffering from Achilles pain, when would it be a good time to go and see someone like you? And then what would a treatment plan look like?
Usually I see these people way past, when they should have been seen. What happens typically when someone, gets this like flare up in the Achilles, let's say, people immediately get worried or concerned. And then the person decides, oh, maybe if I rest it, it might get better. But a lot of times for a true Achilles tendinopathy, absolute rest doesn't make it any better. And in certain cases, it makes it worse because now you're also deconditioned as well.
So your recommendation there would be to maybe first try to just, let's say, reduce the volume rather than stopping totally and see if that resolves it rather than stopping completely. Would that be a fair way to summarize it?
So what's interesting, and I've worked with people through like Achilles tendon stuff. If we're talking about volume, of course, when it first gets irritated, you may want to reduce the volume just because it's irritated and, it's aggravated at that time. But when I'm actively working someone through like an Achilles tendon issue, we talked about reducing volume. In these particular cases, I actually focus more on decreasing the amount of speed work one is doing first, rather than the volume. Because like I mentioned before, with the Achilles tendon, it seems to get a little bit more aggravated, and it depends on the person. Everyone's a little different. But I've worked with plenty of people, they were dealing with Achilles tendon irritability or tendinopathy, and I remember helping them rehab through it, and then I remember getting them ready for like a big marathon. Something during that time, as we're training, especially when we were approaching peak week, peak week means like they're doing the most volume and intensity at that time, right, to be prepared for their race. So I was noticing that, and paired with her symptoms, that it was getting a little irritated, and there were compensations happening with her running as well. So what did we do? How did we navigate her running at that point when we noticed all these compensations happening? Because all I did was I just mentioned, for now, let's just get rid of the speed work. It seems to be the thing that aggravates it. In her case, it was. And let's maintain the volume because it seems like the Achilles tendon handles that really well. And that happens for a lot of runners too. And sure enough, we were able to navigate it. She went through peak week, was able to maintain the same volume, didn't really get any flare-ups of symptoms, and she didn't get injured. It was able to recover. And then, what was it? During the race, she ended up doing a personal best. Actually, she ended up like Boston qualifying.
That's amazing. So basically, maybe not a good idea to hill repeats and lots of intensity when you're suffering that, but also not a good idea to stop running completely. Other than modifying training, are there other things you would consider like massages, stretches, strengthening for a runner like that?
Well, if we really are actively trying to work on building the capacity of the Achilles tendon, passive modalities aren't going to do much. They might make it feel better, which can be very helpful. But if we're thinking about actually creating a stimulus to get thicker and stronger tendons, the way that we do that is not through stretching, but rather through strengthening. I've had plenty of people come to me with Achilles tendinopathy, and they said, I've been doing all the strength work, but it's not working. Well, let me see, what are you doing for Achilles, for building up strength in your calf? And a lot of it ends up being just like, it's almost high volume, low intensity, high reps of like doing 20 calf raises and all this kind of stuff. And I think there's a time and place for that, especially when it's irritated. But in order to really build up a tendon, you need to do like heavy, slow resistance training. In order to create a stronger, thicker tendon, we need a certain amount of strain on the tendon, because a calf stretch won't do anything. It kind of lengthens at the muscle, not necessarily at the tendon. But when we work the muscle, and that's the reason I care about calf strengthening, is not necessarily for stronger calves, but it helps the tendons a lot of times. Because if we actually work the calf hard enough, that will cause a certain amount of strain on the tendon. But also, what it's important to note is the tendon is viscoelastic. It's kind of like, have you ever had like taffy, like that candy?
Yeah, sure.
So I like to explain it like this. So if you try to take the taffy and you try to pull it really quickly, it doesn't really budge. But if you pull that taffy slowly, it starts to stretch and elongate. And that's what we want. That's why a really common way to help build up the tendon is through heavy, slow resistance training.
So the first things to think about then would be looking at the type of training that you're doing, building up strengths in your calves. How long would you have to expect to deal with this annoying Achilles issue?
It's a good question. I have a colleague, Chris Johnson. He works with plenty of endurance athletes, and he has a saying that says, tendons take time. And I think that's important to remember, because it does. I think the reason why sometimes this rehab, quote unquote, doesn't work is not because you're not necessarily doing the right stuff, but rather you don't have the patience to really see it through. Because these things do take time. It also depends on the area, I'll say. So for like a mid-substance Achilles tendon issue, a common saying is 3 to 6 months. So just to put it in perspective, like, it does take time. And when it comes to insertional Achilles tendinopathy, that can take longer, actually. It could be like a year or over a year.
Probably also reiterates the importance to continue running, right? Not running for 6 to 9 months. That is probably not great for any part of your body, and will make it just harder to come back without injuries.
And this is kind of the tricky thing, and what I always work on is when we're working with these injuries, just because you're injured doesn't mean you don't have to run. You can't run, right? We just have to modify it based off certain things we talked about, right? So examples being with running, let's say I'm returning someone to run. What are things that I consider, or, to get someone back, to reduce strain on that area and help it a little bit more? A good example would be, let's not, stay on even surfaces. Don't go uphill. So maybe if you are dealing with hills, like you're going to walk going uphill, then you could kind of, jog down. Another thing with this is, and speed matters, right? So we do take away all the speed work, and we really focus on our easy runs or what's tolerable. So typically I try to incorporate some form of run walk that the body can handle without it, further getting irritated. Because there is something about the Achilles tendon, or any tendon, when I say handle, sometimes this pain, you might feel it as you run, but sometimes you might feel it not during the run, but a few hours after, or a day after. But we want to make sure that pain goes, returns to baseline within 24 to 36 hours.
Is there a pain guideline where you say, okay, my pain shouldn't go above a certain level, or if it does, I better stop? I reduce my volume. If it stays within, I don't know, a 2 out of 10, I can continue running.
Yeah.
Is there something like that for Achilles tendinopathy?
Oh, absolutely. I mean, I have to. Especially with runners, I have to always give pain guidelines. Always. Otherwise, endurance athletes are really good at enduring things. So if you tell them to do something, even though it hurts, they'll push through it. But that's why I always like to set parameters for it. So typical pain guidelines that I pretty much give to all the clients I've worked with is, the first one is, we think about the intensity of the pain. We want to make sure that pain is below typically 4 out of 10. The issue with this part that I find is whenever I give a number, everyone's pain is always one below that. I've messed around with this before. So I'll say, yeah, don't go over 4 out of 10. Then I ask about their pain, and it's like, oh yeah, it was a 3 out of 10. And I think for a certain period, I just decided, and I do, there's a certain period, I was like, oh yeah, don't let the pain go over a 3 out of 10. Guess what the pain level was, as we chat? Oh yeah, it's a 2 out of 10. So
The magic pain level.
So I like to add a little bit of a component to that, making sure that it doesn't feel like it's aggravating. Because that's the whole premise behind it. Some discomfort is okay, especially when navigating Achilles tendon issues, but we don't want it to feel like aggravating or sharp or intense. The second thing I typically mention is I don't want limping. Like, even if it's painless. I think this is something this has happened to certain runners. They'll feel like, yeah, I feel like I'm limping, but it doesn't hurt. Well, that person's already compensating. And again, we're trying to take a restorative approach. So something I say is like, we don't want any limping, even if it's painless. And then I think a third thing to mention, particularly with these guidelines, is I don't necessarily want the pain to get worse, because something that happens with the Achilles tendon, or just a lot of tendons, is it has like this warm-up phenomenon. So sometimes you might initially feel it and be stiff, but as you run, it gets better. It's because it's warmed up. However, there are scenarios, this even happened today, working with a runner today, is she started running, the pain started going away as she ran, and then somewhere along the run-walk progression that we've created, she started having, the pain started coming up again, and that's when she stopped, right? And then we staged it and we understood. It's natural for the tendon to warm up and feel better as you go, but it shouldn't really get worse. And then the fourth thing that I mentioned, and I kind of already mentioned this a little bit already, was that I want the pain to return to baseline within 24 to 36 hours. Like I said, it's normal to get pain a few hours. You might not feel pain now, but you might feel pain a few hours later or even the next day. But I want it to pretty much go away within 24 to 36 hours. If it seems like it's persisting over 36 to 48 hours, there's a chance that we need to modify things or adjust certain aspects of the running or exercises that we have laid out.
Let's assume I'm this unfortunate runner. I've been dealing with Achilles pain for 9 to 12 months. I've been really good with my strengthening exercises. My calves are looking like a cyclist weightlifters, and I still have pain. I understand there's like other treatment options that then come into the play: shockwave therapy, injection, surgery. Is this like a common thing that people end up having to go to, or is this really like the rare exception? And are there other risks or the benefits of these type of treatments?
I think there is some research that mentions, like, with shockwave therapy being, somewhat helpful. However, I will mention that typically for physical therapy, it's usually the opposite way. I usually see these people after all those things. I've seen people that spent thousands of dollars on, and I could think of a bunch of them in my head just now, that they've had the injection, they've had the compression socks, they've done boots or braces and, all these special things. They've had massage, they've done all these passive modalities. But a lot of times then I come see them and then we work on more of an active approach, and that seems to help. Of course, everyone's situation is a little bit different. I think it's important to actually differentiate if it's actually an Achilles tendon thing. Because in certain cases, it's not, and it might be something else. I mentioned the paratendon thing, right? Because how we treat that's a little bit different. Because, again, that's kind of the sheath around the Achilles, but that's something where certain NSAIDs can be helpful in that case. Though there's plenty of situations that when they do have the paratendon thing, they also actually have tendon things, so it's a mix of both. So that's where it gets a little complex.
Is that something that a normal runner would be able to differentiate, or is this a time to go and see the doctor or physiotherapist to understand the difference between?
There are kind of key differences. So unlike the tendon, which is kind of the structure, right, the paratendon is a sheath around the tendon, and it can be incredibly painful too. So the pain mechanism behind that is the rubbing between the tendon and the paratendon. And it kind of almost acts a little bit like an insertional Achilles tendon thing initially, because it'll bother you with increased dorsiflexion or, when you bend that ankle and stuff like that. But there are some key differences. So you might hear a little bit of creaking or what we call crepitus. That could lead to signs of possibly being a paratendon thing. Another key difference, though, I will say that really helps me decide is the difference with how it feels with heel raises and hopping. So typically with a true Achilles tendinopathy, let's say, hopping is actually more painful than doing a heel raise. In fact, heel raises are usually okay. When it comes to a paratendon thing, it's the opposite. You might find that with heel raises, it bothers them because it's kind of rubbing, that sheath is rubbing. But when it comes to hopping, it actually doesn't feel too bad. Why is that? Because essentially when you do hop on one leg, while it does work, nothing really moves. It's more like isometric or stationary. We talked about strength training, but how are you implementing that is really important. It's important to understand that because how you apply it can be slightly different, and maybe you aren't ready for strength training. Maybe we need to get it to calm down first, because it's kind of like a house. If it's, if a house is on fire, if you start trying to build on a house on fire, it's only going to catch up into more flames. So maybe first we need to calm this thing down first, and then build it up. And then the second thing I'll mention specifically with like the Achilles tendon is, again, it's understanding sometimes the details aren't necessarily in the running, but it's actually within your daily life. For instance, I mentioned that with an insertional Achilles tendinopathy, it does get irritated with increased or ankle dorsiflexion. And for certain people, you might find that they have a habit of trying to stretch it out, or they're trying to rub it or scrape it, or maybe they like climbing. So the thing about climbing shoes is that they're typically very tight, so it'll press on that Achilles tendon and further aggravate it. So it's important to look at things from all aspects of life and see what is contributing to it.
That's definitely an interesting one, because it's one that first, the first thought you'd have, hey, it has to be from running, but there might be other factors influencing it. Okay, so to do a quick recap, how do we know whether we got Achilles tendinopathy? We feel a pain close to our heel or slightly above that. Once we have it, it might be a good idea to look at the type of training that you're doing. Avoid hills, avoid some of the more intense sessions and speed work. Build your calf strength. Don't stop running unless things are really bad. That's my layman's takeaway. And of course, for individual cases, things might look a bit different. Is there anything else that would be really important to cover?
Because we talked about strengthening. The biggest things, I hear it all the time, is being scared, building confidence in the Achilles tendon. Because a lot of the reasons why people don't do heavy strengthening is because they're worried about tearing the area. But something I like to mention in a lot of cases, the Achilles tendon is much stronger than people typically visualize. So that's my little tidbit there, is like, don't be scared to load the area. Obviously, given the circumstances. But your Achilles tendon is typically much stronger than you think.
That mental block probably prevents you from doing the strength and the weight you need for those exercises to be effective. For the type of exercises, are there certain exercises better than others?
I just care about strengthening it hard enough. You used to think, eccentric exercises are the best. Typically, what we find is, again, just work the muscle hard, so it creates that stimulus on the tendon to make it thick, more resilient. Mm-hmm. So that's how I see it. Like I said, let's keep that simple. And then if it's a little bothersome, if it hurts with that movement, maybe start with isometrics or stationary holds initially. That can be a great starting point for someone to start to build capacity or start to work the tendon.
Keep it simple.
Something like heel raise holds or single leg heel raise holds.
Okay, so simple exercise is something that you can commit to do consistently. I think that's a common theme with the advice that you give.
Yeah, I feel like people overthink things. I think we overcomplicate a lot of these injuries and how to approach it. And then if it seems complicated, then there's no action. And like I said, these are things that typically don't go away on its own.
We covered a broad spectrum of questions around the Achilles tendinopathy. If you want to know more about this, they have a few ways to learn more about Achilles tendinopathy. Go to Movaia.com if you want the running form analysis, see if overstriding or foot strike might be a problem. Also, check out JP's social media, which we will make sure to drop in the show notes. Also there you'll find a lot more information on this topic. And if you have ideas for future episodes or any questions, then send us a note at community@movaia.com. That's MOVAIA.com. Thank you so much, JP. We'll be catching up again soon.
And take care. Bye.